Hi, my name is Paul Jacqueth. I'm the president and CEO of the Mental Health Association of Southeast Florida. I've been with the Mental Health Association as president and CEO now about 4 years. Originally started as a board member, but also I know Mental Health Association for many years because I've been associated one way or another, either as a funder or just as a supporter in the community. Mental Health Association has been around for almost 59 years. And well established in this community. We don't compete with any other providers. It's really an opportunity for us to work with other providers in a supportive role as an advocate, providing education, and of course our drop-in center, and we offer a variety of services. We do parenting services for parents who've had children removed from their homes. So we work with the parents to try to get them reunited if appropriate. We work with parents who have gone through a divorce or separation and it's an acrimonious relationship, and we work with the parents to try to get the kids out of the middle of it. We have children mentoring programs called Listen to Children and I'm Thumb Buddy, where we go to schools in Broward County and provide mentoring services to kids from kindergarten up to grade 6. And like I mentioned before, the Drop-In Center, which is the Muses Art Center, which will be celebrating 20 years in existence in October. And it's really a real working art gallery. It's staffed by artists. It's not a therapy program, it's an art program. So the main tenet of that program is to connect people to one another, because we know that one of the things that happens when someone gets diagnosed with a mental illness is they become isolated socially, emotionally, and so it's an opportunity for us to help people reconnect to other people. That's really our primary mission, is getting people connected to one another. They understand what the resources are and that there are other people out there that will help them. Yeah, in terms of the Nine Muses Art Center, we know, for example, you would think in this day and age that we would have kind of gotten over it already when someone gets diagnosed with an illness, a mental illness, and that there wouldn't be all kinds of interpretations made about someone based on, that person has schizophrenia, or, better still, when someone is referred to as a schizophrenic, which is just a ridiculous statement to make, because someone is not a diagnosis. They're a person who may have a diagnosis, but we still deal with and still battle with the issue of stigma. So what happens is when someone gets diagnosed, the average length of time, from when someone is first diagnosed with a major mental illness, or when they first start experiencing symptoms rather, the average length of time before they seek treatment is 7 years. That's the average. So you can imagine when someone is first experiencing symptoms of schizophrenia, when they're hearing voices, when they're feeling things that are not there, when they're getting paranoid, the average length of time before they seek treatment is 7 years. That's 7 years more of damage done because people don't want to seek treatment because of the stigma associated with it. You imagine what it would be like if there was no stigma, people recognized something's wrong, I need help. It's like if you go to the doctor and your toe is hurting. You don't wait 7 years before it becomes a throbbing mess and then go to the doctor and now they have to amputate from the knee down. Whereas if it had been taken care of initially, and it's no different with mental illness, the longer you wait, the worse the outcome, the worse the trajectory of the illness. So if you get it early enough, you treat it early enough, the outcome is far, far better. There's an initiative with our national affiliate, the Mental Health America, which is based in Washington, called Before Stage 4. And what we're trying to accomplish is to help people understand, just like any other illness, we wouldn't wait for stage 4 cancer before we would seek treatment or get reimbursed for treatment. Yet, when it comes to mental illness, try to get reimbursed when someone first starts experiencing symptoms. It's very challenging, very difficult to get reimbursed for an organization that's treating someone who's just beginning to experience the symptoms of schizophrenia. So if we wait till it gets to the point where the voices are talking to them, they've committed a crime, then it's too late. The illness has really taken in. So we really have been working very hard to get the message out. As soon as symptoms occur, now's the time to intervene. You know, let's say, for example, heart disease. Someone's having heart palpitations. You know, we're not waiting until they've actually, I mean, generally you don't wait till someone has the heart attack before they get rushed to the hospital. So right now, the way our system works is when someone has the symptoms completely out of control, now they're in trouble with the police, they've done something they get picked up for, now they're getting into the criminal justice system, and now it creates a whole series of events in their lives that really change and alter the direction of their lives forever. And had something been able to be done before that, we probably could have stopped that trajectory from going in that direction. Now, in our community, we're very fortunate because we have one of the 2 teams in the state of Florida, which is an early intervention first episode treatment team at Henderson Behavioral Health, which has been set up specifically to deal with those issues. As soon as someone starts experiencing symptoms, there's a team that has been put together with a wide range of professionals that will go in and intervene, try to get the person on medication as soon as possible if that's what they need, get the intervention, get the case management, whatever they need as soon as they can. And the outcomes to that are remarkable, because what it starts to show is that if you move in early enough, you can prevent the disease from really getting too far along the progression, and the person therefore has a much, much better outcome, and their life is immeasurably helped. So there are a lot of initiatives, a lot of recognition right now that the earlier you move in, the better. Stigma is one of our biggest enemies. It continues to be, and that's where we do a lot of work. That's what we do at Mental Health Association, is try to work on that stigma issue. Services in Broward, the system of care is a pretty robust system of care, despite the lack of funding. The state of Florida has, for whatever reason, taken a position of not being supportive, although that has changed in the last legislative session. I think people are beginning to recognize you can't keep taking money out, taking resources out of the system, and expecting that somehow or other this problem will go away. Right now, our jail system is by far the largest provider of behavioral health services anywhere, and it's a national issue. It's not just in Broward County, it's not just in Miami-Dade, it's not just in Florida, it's everywhere. So until we begin to recognize that A, people going into the criminal justice system are probably not getting the best treatment that they could, and B, that if they are getting treatment, that they are now involved in a system that takes them down a road that they didn't need to go down. So if we can get people treatment earlier, we can get them involved in treatment earlier, it's far less costly. We know the data is there that shows someone who goes into a criminal justice, into a jail cell, is far more costly to the system than someone that's getting treatment. It's night and day difference. It's tremendously different. So from the standpoint of services, the services are available as best they can, but I can tell you there's waiting lists. The need exists, it's a tremendous amount of need, and the need far outweighs what is available in terms of resources. As much as there are treatment services available, it's a very complicated system to navigate. I mean, I'm a licensed clinical social worker. I'm a certified addictions professional. I have 30 years experience in the field. I have a hard time negotiating the system, and I should know how to do it. Can you imagine someone who is hearing voices, someone who's extremely depressed, who can barely get out of bed, has now got to navigate a system that is so large and so difficult to figure out? They're not likely to be very successful at it. So a lot of what we do at the Mental Health Association specifically is try to connect people to services. The biggest challenge for people is that they feel like they're doing it alone, and they can't rely on someone. I've talked to people on the phone so many times who've called and just, they're exasperated. They don't know what to do. You know, I've called this place, I've called that place, I don't get a call back, or I'm not sure what I'm supposed to do. And just by listening to people, a lot of times that's just what they needed. They just needed someone to hear them and hear their frustration, and can you help me out with this? And so that's what we do. We do link people to services. There are services available, but sometimes they're difficult to find. Sometimes they're challenging to get connected to. And so we have a pretty good system here in terms of peer support services, and our peers are pretty sophisticated in understanding the system, and quite frankly, they've been through the system, so they know how it works. So they can not only talk the talk, they can walk the walk. And that makes so much difference for someone who's just kind of getting into this whole system and trying to figure it out, because now they have someone that's going to walk them through it, hold their hand and tell them this is where you need to go for this is what you need to do here. And of course, the complicating factor is when somebody becomes symptomatic, they're less likely to follow through. So our work is try to help someone when they're in that danger zone, when they're really in that position of, I don't really need this anymore, I'm fine, everything is good, and things are really falling apart around them. We have systems in place to kind of help people get reconnected. And again, stigma plays a part in it, plays a role in it, because the first thing someone does oftentimes when they get stable is, I don't need this anymore, because they don't want the association with it. So, that's all part of that same issue of what other people think about folks that are going through the system of care and what it means to them. And we've got a long way to go there. That's a lot of work left to do. It's really all peer related. I could talk to people and tell them, I don't see you any differently. I support you, but I'm not there. To hear it from someone who's been at the state hospital 4 times, who's gone through ALFs 3 times, who's been to this case management program, that case management program, to hear it from that person who's lived the experience, who's walked the experience, is just a tremendous connection for that other person to think, you mean you not only did you survive it, but you seem to be thriving in it. So what we do, we hire people. We don't like to refer to the peers we hire as peers. We like to refer them as employees. They are employees with the same expectations as anyone else, as far as I'm concerned, as it should be, so that if people feel like this does not have to be the end of the road, and that for a lot of people it becomes that feeling like I give up because I'm never getting out of this. It's a dark place to be in when you're really symptomatic. And wouldn't it be great to know there's some place where this might take you? It may alter your life, and it probably will, but wouldn't it be great to have a place that hey, maybe I can make something of this and make it to be, something that's going to be beneficial to me and to my family. For a lot of the folks that we work with, they've been disconnected from family members because they've burned all those bridges, and you understand why family members get, I've had enough of this, I can't keep doing this. And through what we experience here, we see a lot of people reconnecting with family members. When we do our art showings, we invite family members, and not to put any pressure on them, but just to simply say, hey, you might want to just see what your person's been up to and reconnect to them. It's really a wonderful opportunity for people to feel reconnected to a relative or a parent or a friend, and we see it all the time where people get reconnected to people. It's a phenomenal experience. It touches your heart when you see it. It's really remarkable. I think we really got to get over ourselves as a society. Stop being so judgmental. Would we look at someone differently because they have high cholesterol and it caused a heart attack? And, so there's always that, volition part of this. If someone just pulled themselves up by their bootstraps, they wouldn't have had this issue to begin with. If they only could just understand not to do this or to take the drugs, or, without understanding what the addiction about, without understanding what the illness is about, people are very judgmental. So, I like to, if we look at it like, well, someone had a heart attack, well, maybe because they were eating too many bagels with butter, and so should we judge them because that's what they did? Yet when someone with some mental illness, somehow or other we find that that's okay to do, to make that judgment. I think we've got so much education to do. we've got to help people get over all of those kinds of thoughts. And like I've mentioned before, a mental illness, it's like you don't know what you need until you need it. And then you start hearing from people, and there are many things that break your heart when you do this job, but one of the things I hear from a lot of times is parents who will come to me and say, because particularly for schizophrenia, it's very typical for symptoms to first start in late adolescence into early adulthood, which is right around college age. So parents will say, my son was going this way, and then all of a sudden this thing happened. And we don't know what that was. We don't understand what happened. And to watch the pain on these parents' faces and the thwarted efforts, at trying to get help for their child, it's really heartbreaking to watch people go through that experience. And what happens to them, again, because of the stigma, they can't talk to anyone about it. They close ranks. They won't talk to other family members about it because they're afraid they'll be judged on their parenting skills. It has nothing to do with that. Yet, we as a society put that on people. We put so much weight into, you did something to cause this to happen. We know that mental illness is a brain disease. There's this new research that just came out. It's remarkable research. They have just found that the brain is actually part of the body. Remarkable research. Yet, we somehow or other make this decision that the brain is a whole different function, and it's not. It's an organ, just like a heart, just like a kidney, just like a liver. Yet when those illnesses hit those components of the body, there's no second thought about it. There's no judgment being made, except for when someone has a mental illness. I think we've got a long way to go with that. I think our political system needs to take this on, instead of getting sidetracked by other issues, mass shootings, which are terrible, and I don't mean to minimize those in the least, but that's not our biggest issue. Our biggest issue is, how do we deal with this problem of stigma and people being judged on something they really have no control over? They really don't. So I think we've got some roads to cover yet with this. I think we've covered a lot. The history of treatment for people with mental illness has come a long way. The trademark of the Mental Health Association is a bell. And I don't know if you know the history of where the bell came from. But back in the 50s and 60s, and even before that, people were locked away in mental institutions, as they called them, asylums. And what they did to people was incredibly inhumane. They would chain people up, lock them to walls, lock them to their beds. And as a result of, there were many issues with the institutionalization, but one of the good things that happened was getting people out of hospitals that shouldn't have been there, and taking the shackles and chains off of people and freeing them to be able to live in the community. So what the Mental Health Association did, and this is where it came from, was to take a lot of those shackles and those chains, melt them down, and they formed a large bell that's on display at the Mental Health America offices in Washington, D.C., to symbolize the freedom and the steps that we've taken as a society and as a community to free people from those shackles and from those chains. And ultimately, that's what we want. We want people to be free of that, not just physically, but emotionally free from those shackles and chains of a mental illness. There's just so many things that we can do to help people with it. It's funny because, in my role, I spend most of my day doing administrative tasks and applying for grants and dealing with the money issues and so on. And I'll come over to the Muses Art Center, which is right next door to my office, and sit down and have a cup of coffee with people, and just to talk about the ball game, just to talk about everyday life. And it's funny because I'll tell people, the reason I come over here is to get sane. It's the only place where I could feel like I can have a real conversation with people, and we talk about real things, and we just have fun with it, and there's interest, and people have interest. And I think if people just recognize that people are people, it doesn't matter what their background is, you can find interesting things. But there's a guy now in our Muses who, from the day I started, he kind of was helping us with doing, picking up the garbage and cleaning the place. And I got to know him over the course of time. And he's an older gentleman and a really bad history. I mean, he's been in and out of prison, in and out of jail, in and out of institutions, in and out of state hospitals, arrested a number of times. So we sponsored him. He had come to us and said, I'd like to take this peer certification course. So he approached us and said, would that be something that you could sponsor me for? And we said, yeah, we'll give that a shot. And it's not an easy course. I mean, you got to get to the course. It's a 3 hours course, a 3-hour course once a week in the evening. You have to get to it yourself for about 9 months. He did that program. He went through it, excelled at it. And then when he got to the end, he came to me and said, I'd like to work in the field. Do you think you could help me with that? I said, sure. And I thought, that's going to be a challenge because he's got criminal history issues, he's got background history issues. And so we started the process. Now, this started 3 years ago, from the time when he started the class. He finished the class. We finally get an opportunity because of one of our funders who was very supportive of peer support programs, the Broward Behavioral Health Coalition. We wanted to hire him for a position. He only wanted to work part-time. The gentleman's 66 years old. And so we had to go through a background screen. And of course, he got rejected. I mean, it took weeks for that to go through that process. We're in the middle of it still, but I have great hope, as does he, that he's going to get through this, and we're going to get him into this position. He's 67 years old, and he says to me, Paul, all I want to do is help people. I want to give back to someone for everything I've gotten. And he said, people, I'm sure, thought they were wasting their time with me, and maybe they were at the time, but something clicked. And when it clicked, it became crystal clear to me what I needed to do with the rest of my life. And he said, I don't have much time left on this earth, but I want to do something that's going to help other people. And to me, that's why I come in every day.